Good morning. Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, reporting for the week of April 19th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID 19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. Now, we know that this pandemic is worldwide, and worldwide, we have passed over 3 million people who have died of COVID so far. And in the United States, over 560,000 people have died from COVID so far. 3 million lives lost from something that we never even heard of a little over a year ago. So we have been going through a worldwide shock. We also know that the effects of this pandemic are very different depending on where you are, and we are here to give you up-to-date information about Alameda County, Oakland in particular. So in Alameda County, we have over 85,000 cases and 1,477 deaths. Both the hospitalizations and ICU hospitalizations are remaining low, and we have made a big impact in stopping deaths in the skilled nursing facilities. And this is in large part due to vaccination efforts in those facilities. So this is all good news. When we look at the 7-day positivity rate of COVID tests, we see that although it has come down very nicely after the wintertime spike, we are seeing a bit of an uptick here in Alameda County, and this is also true statewide in California. And so while it remains low, we never like to see things heading in the wrong direction. So this is something that we'll continue to keep an eye on. And this is up from last week and the week before when I reported, and they were at 1.4%, now 1.5%. So again, still low, but headed in the wrong direction. Vaccination rates continue to increase. We now have over 60% of those who are eligible, so that's 16 and up, having had one dose, and about 37% of those who are eligible having had two doses. And again, those are for those over 16. So just with our rough math, we are still a little under 30% of the total population. And this is in Alameda County and also in Oakland. So a little under 30% of the total population having been vaccinated. So great rapid improvements, but still nowhere near herd immunity. And vaccination rates, of course, remain uneven as well. And the lowest vaccination rates are in East Oakland, in those same zip codes that have been disproportionately impacted by COVID. And the two zip codes with the lowest vaccination rates currently are 94621 and 94603. By way of update, you'll recall that the CDC and FDA issued this health alert recommending a pause on administering the Johnson & Johnson vaccine. And I went over this in some detail in a special briefing this past Friday, April 16th, which you can find on our YouTube channel or on our Facebook page. But in short, the pause is due to a rare complication called cerebral venous sinus thrombosis. And this is a specific type of clot that is formed in the vessels that drain blood from the brain. And what is very unusual in these cases is that it is occurring at the same time as a low platelet count or thrombocytopenia. So, and this occurred in 6 women after the clinical trials were completed. So what's happening is that at the same time they have a clot, they have a condition that keeps them from clotting. And this pause was done really to put us all on high alert. So first, this was an alert to patients. So if you or someone you know got the J&J in the past month and you get any of the warning signs, we want you to seek medical attention immediately and let them know that you got the vaccine. And those potential warning signs are severe headache that won't go away, may be accompanied by nausea and vomiting or visual disturbance, could be stroke-like symptoms, so weakness on one side, maybe some difficulty with speaking, could even be seizures. Signs of clots that form in other areas could include severe abdominal or back pain, shortness of breath or chest pain, leg pain, or swelling. And then some signs that you may have that low platelet count include tiny red spots on the skin or unusual bruising. And again, these are things that we want you to be on alert for if you've had the J&J vaccine within the past month. Although the vast majority of the cases seem to be happening within a few weeks. Second, it was an alert to physicians that if we hear complaints of these symptoms or see these clots, we need to be asking about vaccination history. And we also need to be doing a specific workup, because what's happening is that the normal treatment for a clot of this nature, heparin, which could be considered first line treatment for this clot, would be dangerous when we have a patient with low platelet counts. So again, physicians need to be on alert. If you've gotten the vaccine and come up with any of these symptoms, seek medical attention and let them know you got the J&J vaccine and when you got it. These are very rare, but we just want everyone to be on alert. And so, by way of recap, the J&J was granted emergency use authorization on February 27th. It began distribution here in the United States on March 2nd. And on April 13th, it was paused. And we've said in general, we've always said that with vaccines, if you're going to see adverse reactions, you're usually going to see them within a 6-week period. And with this particular issue, it appears to be happening more like within a 2 to 3 week period. But nonetheless, these are things we want to be on the lookout. And we'll just say within 1 month of the J&J vaccine to be on the safe side. So for now, we have the mRNA vaccines, Pfizer and Moderna. And for those two vaccines, we do have quite a bit of data now. Those were the first ones that were approved here in the United States. And we had very large clinical trials. And now we have several months of experience. We've gotten back the 6-month data from Pfizer, the 6-month post-trial data. They look excellent. We've also seen a couple of other studies on the lasting protection. And now we can securely say that even 6 months after the Pfizer vaccine, we still have excellent levels of protection against COVID-19. So that has been very impressive and very reassuring. And we'll just keep an eye out, because we expect that there can be decreasing immunity over time. We also know that there are variants around, so the chances of needing a booster are certainly there. And so we'll just need to keep an eye on what those recommendations are going to be. So cases are down, although they are ticking up slightly here, and they are surging in other parts of the world and in other parts of the country even. But here they're down, although ticking up slightly. And we have 2 excellent vaccines that are preventing severe illness and death. So how optimistic should we be? How safe should we feel going back to activities we were doing previously? And what is sort of the overall outlook now? So, whether you should be going back to activities you were doing previously really completely depends on whether or not you're vaccinated. So, if you are vaccinated, then certainly you can do more than before, and you are now enjoying the protection from severe illness and death from COVID. So that those are great things that should give us a lot of reassurance. But how much you do, I think, depends on a number of factors. And really, I think experts here have differing opinions on this. So this kind of goes back to your risk tolerance, or how you weigh out your risks and your benefits. And each one of us should be able to do this for ourselves with the proper information, as much information as we can have. So I think the factors each of one of us should be considering as we weigh out our risks and benefits are how much virus is circulating around where you are or where you want to go. And most places certainly have dashboards up. You can take a look down to your neighborhood here in Alameda County. You can look at your zip code and see how much virus you have circulating. And certainly most counties across the country have this. So how much virus is circulating is definitely a factor, because you are mixing around. And so even though we know that the risk is low of you contracting it, we're still looking at that, 5-6% around that area. And so the next consideration would be, how concerned are you about getting mild or moderate COVID? I think we all feel reassured about not getting sick enough, hopefully, to go to the hospital or die. This is happening just very, very infrequently. And once you're fully vaccinated, But, mild or moderate COVID is not necessarily going to be a picnic. So I think that's something else to consider. How concerned are you about getting mild to moderate COVID? And this depends probably on whether you have underlying conditions, your age, etc. And third would be, how concerned are you about spreading COVID to others? And so, again, how much virus is circulating where you are or where you want to go? How concerned are you about getting mild or moderate COVID? And how concerned are you about spreading COVID to others? Now, again, if you've been fully vaccinated, we think that the risk of you spreading COVID to others is fairly low, but this really depends on what your activities are and who you live with and how much you are going around others unmasked. So, if case rates are low in your area, you don't have many risk factors, you don't go around unvaccinated people unmasked, then your risk calculation is going to be a lot different than, say, someone who lives in a high prevalence area and has risk factors for more severe disease and lives in the home with people who are unvaccinated. And of course, right now, that will include all children under 16 years old who are all unvaccinated. So these are all things to consider. Now, when we get to herd immunity, then we can say that those who are vaccinated are protecting those who are unvaccinated. But until then, all we can really say is that your vaccine protects you. It's also giving some protection to the people that you go around unmasked from you. They're not protected from others who may be unvaccinated. So, but members of your household, let's say, who are unvaccinated, are certainly more protected from you if you are vaccinated. So, this is to protect yourself, it's to protect those around you who are unvaccinated. And if you are fully vaccinated, the data seems to be telling us very clearly and consistently that although you have a small chance of catching COVID, your risk of getting severely ill or dying from it is very much all but almost eliminated, really. Very small risk. And the chances of you passing it on, even if you get it, remember we're talking about 5 to 6%. And even with the variants that we are currently seeing circulating in the United States, you still have good protection. So, a reminder on the variants: the CDC, along with a group of actually multiple federal agencies, got together and created a classification system for emerging variants. And they are actively monitoring what those variants are doing as it relates to our countermeasures, like our vaccines and our diagnostics and our therapeutics. And so the three categories are variant of interest, variant of concern, and variant of high consequence. And since I reported on this about 2 weeks ago, the CDC has actually added three variants of interest to the list. Two of them were first noted in New York and one of them in Brazil. And there is concern that these variants may not be as susceptible to treatments or the vaccine. So these are being monitored. We're not seeing much of them here, but we are seeing them in other parts of the country. And we need to keep an eye on these to see if they're going to make it into the next category, which is variants of concern. And we still have 5 of these variants of concern. So the one that is really taking over the most quickly is the second one here, the B.1.1.7, or the UK variant. And this variant appears to be more severe, and that is based on hospitalization data and case fatality data. It also appears to be more contagious. It is more transmissible, including among children. And it seems to be affecting children more, where they are getting more symptomatic infections and even sometimes more serious illness. Still less than adults, of course, but because a lot of our older adults are now vaccinated, we are certainly seeing a shift. And this shift is going to be something that we will see most likely in children as the main unvaccinated population. But we're also very concerned about our unvaccinated adults, and particularly those who are more vulnerable to getting very ill with COVID 19. The top 2 variants here are what we were calling the California variants. And you sometimes hear people call them the West Coast strains, but these are really pretty prevalent here in California, and they are not a lot more contagious, but they do seem to be avoiding a little bit of our treatment and maybe somewhat with our vaccine. So, really, we are pleased that we have low case rates here because that avoids things from spreading as quickly. But because we're not at herd immunity, we do expect these variants to be able to take hold. And so, how much can they take hold and how much are they going to wreak havoc? This is going to really depend on how quickly we can get ourselves to herd immunity. We don't yet have any variants of high consequence. Thank goodness, those would be ones that are clearly avoiding our prevention measures or our treatments. And we don't have any of those yet, thank goodness, but we are keeping an eye out. So, if you're fully vaccinated, we're feeling pretty confident that at least with the variants we're seeing here in California so far, you are protected. So, we know that you can reintroduce some activities with caution. Now, for those of you who are not yet vaccinated, I have no idea why you are letting your guard down right now. We see it, we hear about it, and really it's a little bit confusing. If you remain unprotected, if you have not been vaccinated, maybe you haven't gotten it yet, maybe you've only received one dose, you're not fully vaccinated, you still need to be concerned about catching COVID. If you've never caught COVID and you've not gotten the vaccine, your body is still what we would call naive to COVID. It's never seen it before. It doesn't have any antibodies against it. So think back to a year ago, April, May timeframe, when I think most of us were sheltering in and concerned. Those of us who could shelter in were sheltering in. Those of us who were essential workers on the front lines, everyone's very, very concerned about exposing themselves to COVID. Well, we actually have more COVID circulating now than we did at that time frame. And so we don't know. And again, we're upticking slightly. We don't know if we'll see a summertime surge. It's likely that we will have more cases than we do now. Again, this is all sort of a race between vaccination, variants, and some other factors. But we are doing quite a bit of reopening and mixing right now. And so none of us, I think, will be surprised if we have some increases in cases over the coming months. Hopefully and likely we'll not get to the extremes of the wintertime surge where we lost a lot of lives and filled up a lot of hospital beds. But nonetheless, we expect that cases may go up. And if you are not vaccinated, then really your risk is as it was, and maybe even greater. And I'll talk about that in a second. Um, but it seems like people are relaxing, maybe because we're coming off this wintertime surge. So, relatively speaking, seems like we're doing great. Maybe also because others around you are getting vaccinated and maybe they're feeling like they can let their guard down, which is probably a little bit more accurate. But for you, if you're not protected, then if you haven't gotten the vaccine, you are not protected because others got the vaccine. We're just not at herd immunity yet. And as we've just reviewed, the variants that we have now are either more contagious or more likely to land you in the hospital, even if you're younger. And we are seeing this in other states where hospitals are filling up with younger people because, again, we're dealing with variants that may make us sicker. And we know that the UK variant has higher hospitalization. It looks like higher fatality rates as well, and are more contagious. So for those unvaccinated people, we're actually a little more concerned about you than maybe we were before. Um, so you still have no immunity to this virus. You remain susceptible, and with society opening up and people traveling more, the risk of more deadly or more contagious variants is actually increasing. We're already seeing that the double mutant strain, which is still under investigation, is not on the CDC's lists yet. But I bring it up now because it may be tied to the big surge that is being seen right now in India. And the Ministry of Health there has named it a variant of concern, although here it's still it's still under investigation, but it has been identified right here in the Bay Area at Stanford. And so we are very concerned that, again, with more people traveling, more variants can be imported. So even though it may not be replicating at a high rate here, we may not be developing as many new mutations here. This is a worldwide situation, and we see that variants continue to emerge now. And by definition, the mutants that stick are usually having some advantage over the old COVID. So they're either more contagious or they're making people sicker. And so we can just expect for that situation to continue until we really get this under control around the world. So the point here is if you're not fully vaccinated, then you should be sheltering in place, masking, spacing, and not letting your guard down because you are still very much at risk of catching COVID. And I have to say that while the vaccines are an amazing breakthrough, they took a lot of focus, a lot of investment, and we really have not added a whole lot in terms of COVID treatment. So, in other words, once you get COVID, your risk of hospitalization and death really has not changed much since the earlier days of the pandemic. So, as a reminder, out of all the people who get COVID, about 1 in 10 will get severe symptoms, about 1 in 20 will get critically ill, go to the hospital, and about 1 in 60 will die. So we really don't like these numbers at all. These numbers may be even getting a bit worse now, although there's a number of factors to consider. Most of our majority of our elders are now vaccinated, so they are protected. But then we have more virulent mutations. So this is, still, but this has not changed much. So your risk of hospitalization and death has not changed much from the early days. And our treatments are very the list is short. The short list of recommended treatments are really inpatient treatments. So basically, you're at home treating it like a cold for the most part until you're sick enough to go to the hospital. Then we go to the hospital. We've basically got oxygen, steroids, and the antiviral drug remdesivir, which is it's okay. So it's giving some improvement, but again, we have not really changed the picture in terms of the fatality rate or the hospitalization rate once you catch COVID. There is one outpatient treatment that is recommended for those in high risk categories, and that is a monoclonal antibody cocktail. You might recall that Donald Trump received this treatment. It is a treatment that is shown to decrease the rate of hospitalization and death in people and the progression of COVID in people who are high risk. And the way it works is it's these Y shapes shown here, and it just clicks onto the COVID spike protein, and that keeps the spike protein from being able to then click onto our receptors on our cells. And so if the virus can't bind to our cells, then it can't get in and it can't wreak its usual havoc. So monoclonal antibodies are intended for people who are high risk of progressing to severe COVID and or hospitalization. And here are the criteria. And you can see that this really includes quite a number of conditions, including common ones like diabetes or obesity. And also it even includes young people, 12 to 17, that have certain conditions like obesity and or even moderate to severe asthma. So this is really important because our, at least 12 to 16, 12 to 15 cannot get the vaccine. So these are still, folks that are unprotected. And so really we need to be testing in order to know if someone is positive and therefore eligible for these treatments. And so to be eligible, you've got to test positive. You've got to get the treatment as soon as possible after getting symptoms, but no more than 10 days after symptom onset. And if you get sick enough to go to the hospital, it's too late for this treatment. You are actually no longer eligible by definition for this treatment once you're sick enough to go to the hospital. So the point here is to really nip it in the bud if possible. And it's not going to be effective for everybody, but it can be. It can actually be impressive in some people. So and so why am I talking about this? It's not a wonder drug. There's no guarantee it's going to keep you from going to the hospital or dying, but it's kind of all you've got. If you're unvaccinated, this is kind of all you've got until you're sick enough to go to the hospital. So this is really a message to those folks, for you all or people that you know who are unvaccinated. Again, now is not the time to let your guard down. We actually have more dangerous strains out there than we had before. So there are actually reasons to have your guard up higher, including getting tested as soon as possible after getting symptoms or after potential exposure. And also because you may be eligible for a treatment that could be useful in some circumstances. And of course, we all need to be thinking about our layers of protection. And those layers of protection for individuals and groups include vaccination for all those who are eligible, age 16 and up, masking and spacing. And you want a mask that properly fits, that stays on your face, and that has good filtration. This may even include double masking, kind of stepping up your masking game if you're unvaccinated, because again, we're dealing with more contagious and more virulent strains of COVID all the time. Testing and quarantine after exposure. And when you're symptomatic, if you have symptoms, then we really want you to get tested, even if you're fully vaccinated. Because remember, we've got that small percentage, and we are going to want you to isolate until you get your results. And if you test positive, please do what you can to get your close contacts to get tested and to isolate as well. And if you are in one of those high risk categories, please do inquire about the monoclonal antibody cocktail treatment. And remember that we are still wanting to avoid poorly ventilated, crowded indoor spaces, period, and particularly if you're not vaccinated. But we're just increasing the risk the more we mix and the more that we are crammed together in, especially in indoor spaces that are not well ventilated. So our layers of protection for indoor spaces include ventilation. So that's opening those windows or those doors. It could be running your HVAC. We also want to make sure we have appropriate filtration. So that could be your MERV or HEPA filters. And disinfection and sanitization, we still believe is important, especially for your high touch surfaces, but even for your low touch surfaces, because we know that those droplets fall somewhere. And of course, we want to be frequently washing our hands and still not touching our face. So, for everyone, optimize your immune functioning, take a multivitamin supplement, consider additional vitamin D supplementation, manage your stress, and get a good night's sleep. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.